NIPT, or non-invasive prenatal testing, is a test that can be done after 10 weeks of gestation, and it can help to determine your baby's risk for different genetic abnormalities, chromosomal abnormalities like Down syndrome, trisomy 13, trisomy 18, and it can also help to determine your baby's sex, which is very exciting. XX for a girl, XY for a boy. When I was pregnant with my son 8 years ago, you had to wait for the 20-week ultrasound to like see if there was a penis or a vagina. So it was pretty exciting this time around to be able to find out that I'm having a girl. I think I took this test at about 10 weeks. And so this test is just a blood test, doesn't harm the baby at all. And what the test does is it analyzes the DNA in placental cells in the mother's bloodstream. And the belief is or not just the belief, they know that the DNA in these cells are usually identical to the DNA in the fetus. So it's a fairly accurate way to analyze, what's going on in the baby. It's important to know that this is not a diagnostic test. So all it does is it tells you if your baby has a high or a low risk of having Downs, or again, trisomy 13, trisomy 18. So again, it just estimates the risk. So if you got results and it showed that your baby was at a higher risk, it doesn't mean that they definitely have Downs or one of these genetic conditions. It just means that they have a higher risk. Usually one of the hardest parts of this test is waiting for the results. It usually takes about 10 to 14 days before your care provider gets the results. So during that time, just try to distract yourself, lots of deep breathing, try to stay calm, sending light to your baby. And again, remembering that even if the results come back and show that the baby is at higher risk, does not mean, again, that the baby definitely has those abnormalities. Regarding who should take the test, anybody can take this test. I'm not particularly high risk, but I opted to get this test. But it's especially recommended for women that are 35 or older, those with a family history of chromosomal abnormalities, or if the mother has a chromosomal abnormality or a carrier, or the father is, then it's typically recommended. But again, it's a simple blood test that's done anytime after 10 weeks of gestation. They need you to at least be 10 weeks to make sure the results are more accurate. All right, if you have any questions about this or anything else about pregnancy, childbirth, or early motherhood, let me know in the comments below.